So this video is a continuation of the topic of adverse drug reactions. Earlier we have discussed type A and type B adverse drug reactions, and here we will compare both the types of reactions and also discuss the other types of reactions to drugs. Comparing type A and type B adverse drug reactions, type A adverse drug reactions are dose dependent, whereas type B adverse drug reactions are dose independent. In terms of nature of adverse drug reactions, type A reactions are augmented, that is, there is extension of the pharmacological action of the drug, whereas type B adverse drug reactions are totally abnormal, bizarre in nature. In terms of mechanism, type A adverse drug reactions result from extension of the main pharmacological action of the drug, whereas type B adverse drug reactions are genetically or immunologically mediated and may be unknown. Type A adverse drug reactions are pharmacologically predictable because they are related to the main pharmacological action of the drug. Type A adverse drug reactions are pharmacologically unpredictable. In terms of incidence, type A adverse drug reactions are very common, so the incidence is very high. However, these are less serious adverse drug reactions and the morbidity and mortality is low. Whereas type B adverse drug reactions, the incidence is low, that is, they are less common, but they are more serious adverse drug reactions with more morbidity and mortality. When it comes to treatment, type A adverse drug reactions may require adjustment of dose, whereas type B reactions require stopping the drug. Other types of adverse drug reactions. These are type C, that is chronic effects, type D, delayed effects, and type E, end of treatment effects. Type C, chronic effects. Adverse effects that are associated with prolonged use of drugs are known as chronic effects. Examples are 1. Chronic use of prednisolone causes Cushing's syndrome. 2. The use of laxatives in constipation. Laxatives act by increasing the bowel movement frequency, but prolonged use of laxatives can lead to loss of muscle and nerve responses and dependency on laxatives for bowel movement. Third example, aspirin is reported to cause analgesic nephropathy. Next we move on to type D or delayed reactions. Adverse effects occurring in patients years after the treatment are known as delayed type of adverse drug reactions. Treatment related to myelodysplasia or secondary leukemias following alkylator therapy usually has a latency period of 4 to 7 years. These alkylating agents include cyclophosphamide, cisplatin, chlorambucil, busulfan, melphalan, nitrogen mustard. The second example is that of secondary cancers that may occur months or years after treatment and are a consequence or side effect of the initial cancer treatment. For example, a patient with breast cancer or Hodgkin's disease may develop acute leukemias years after the completion of treatment for their first cancer. The third type of example of delayed reactions are teratogenic effects of drugs. For example, the daughters of women who use diethylstilbestrol while pregnant have about 40 times the risk of developing clear cell adenocarcinoma of the lower genital tract than unexposed women. Diethylstilbestrol was a synthetic form of estrogen. Doctors used it from 1938 to 1971 to help some pregnant women who had miscarriage or premature deliveries. At that time, it was believed that these problems might have been caused by low levels of estrogen in the woman's body. In 1971, the US FDA advised the doctors to stop prescribing it during pregnancy. The next type of adverse drug reaction is type E or end of treatment effects. These adverse drug reactions occur when a drug is suddenly discontinued. For example, patient is on treatment with beta blocker for hypertension. Abrupt discontinuation of beta blocker can lead to a rebound effect characterized by hypertension and tachycardia. Second example, a corticosteroid such as prednisolone should not be abruptly withdrawn after it has been used for more than 2 to 3 weeks, as it may precipitate adrenal insufficiency. Withdrawal should be done gradually by tapering the dose. The third example, anti-seizure medications used in epilepsy once initiated are typically continued for at least 2 years. Abrupt withdrawal of anti-seizure medication can result in rebound seizures. Tapering and discontinuation of therapy can be considered after 2 years if the patient is seizure-free for the entire period. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.